Now for today's speaker, we have Michelle Millner, who is a doctor of physical therapy. And as the old commercial used to go, that not only is she a doctor of physical therapy, but I'm also one of her patients and therefore know her quite well. She is an excellent physical therapist. She can give very good diagnostics. She really helps. And anyway, here I go on. I'm going on about how well I like her, but let me just say, again, I highly recommend her. With no further ado, I'd like to turn it over to Michelle, and we can learn about things that have that as we age, we need to continue to do. Michelle?
Well, thank you for that very kind introduction, George. I really appreciate it. Let's just get the screen share going here. All right. So again, thank you so much for having me come to the Old Guard and speak with you. And I'm hoping that you all get a lot out of this. As George said, I am a physical therapist. A little bit about me. I got my doctorate degree from Rutgers University very long time ago, about 16 years ago. And since then, I've mostly focused on outpatient orthopedics. So that includes helping a lot of community dwelling older adults maximize what they can do. And so without going on too much, let's get into our talk today about maintaining functional mobility as you age. So the purpose of today is to kind of break it into three categories. First, understanding the importance of maintaining your mobility, discussing some common problems that lead to limited human movement, and then providing you guys with some strategies you can start to use right away on your own. So what even is gross mobility or functional mobility? So these are the things that we do every single day and we don't even think about it, or at least most of us don't think about it. Things like rolling over in bed, getting out of bed, standing, walking as soon as you get up to stand, negotiating stairs, curbs, getting in and out of a tub, walking, getting up and down off of a toilet. These are things that for most of our lives, we don't consider them to be effortful at all, but they're actually pretty important. And we end up, taking them for granted. And I encourage anybody who is not thinking about these things to stop for a moment and appreciate how much freedom that actually gives you in your life, and to learn not to take for granted what those skills are. So I just wanted to help us give a better appreciation to those skills, to kind of delve into human development just for a minute. And when an infant is born, 0 months old, an infant has no control over their body whatsoever, right? It's essentially just a very cute little blob. But as time goes on, these infants have to learn how to first lift their head and neck, and then learn to roll over. That's the first step towards mobility. And that doesn't happen for about 5 or 6 months usually. From there, children go on to learn to sit, crawl, hold on to things, to start to creep along furniture. And then from there, you finally, a baby after almost a year gets the confidence to take a step. So this whole process takes a year, right? And that's just the very basic getting up off the ground and walking. It takes another 4 to 5 years for a human to develop really good motor control, meaning running, jumping, playing. Maybe they start doing a sport. That takes 4 to 5 years. So it gives you a really big appreciation for how long it takes for a human to get onto their feet and to move. But the problem is that we start to take that for granted in our younger years and even through our middle years. And our body says one thing and our brain says another thing, right? So your brain might be telling you when you're all comfortable on your couch at the end of a very long workday that you just want to stay there, or that you should be getting up and doing something, but then your body just simply says, I'm not going to do it. And you're just not going to do it, right? I know I am guilty of that. I'm a physical therapist and I 100% admit at the end of my workday, I do not want to do anything. It's just how we are, right? So the thing is, we start to take these things for granted, and then we create this downward spiral of mobility over our lifetime, essentially, because instead of using our lifetime to maximize our mobility, we take it for granted. And this starts slowly in our middle years, usually in our 40s, 50s, 60s. And then we start to neglect the things that we need to do to maintain. That causes deconditioning. And then from deconditioning, you start to lose your movement skill. And then from there, you start to compensate how you move, how you walk, how you stand, how you get off of a seat or whatnot. And then from there, because you're overdoing or overusing certain muscles or underusing certain joints, you end up breaking things down. That breakdown then leads to pain, injury, potentially even illness, depending on the circumstances. And ultimately, over decades, this becomes an inability to take care of yourself, right? So kind of a classic example that I see a lot is like navigating stairs. That's a big one. As we get into our middle years, even up into your 70s and 80s, stairs are not a problem. But then inevitably somebody moves to a house that doesn't have stairs because you think it's better for your health. In many ways, that's probably true. But then you just don't do stairs. You don't practice that skill anymore. And then you go to someone else's house when they have a whole flight of stairs to go up, and it's like, oh my gosh, how did this become so difficult? That's that sort of classic example. Now, the consequence of this, and the scariest consequence of this, is falls. Falls are probably one of the worst things that could ever happen to an older adult or anybody as they age. And these are just some statistics from the CDC, which are pretty enlightening statistics, I suppose you could say. More than 1/3 of individuals over the age of 65 fall. Of those who fall, you're 2 to 3, if you fall, you're 2 to 3 more times likely to fall again. Every 17 seconds, someone is treated at an ER for injuries due to a fall. Every 30 seconds, someone dies due to injuries from a fall. And 90% of all hip fractures in older adults are due to falls. 1 in 5 individuals who suffers a hip fracture, so 20% of people who have a hip fracture due to a fall, will likely die within that same year, right? Those are terrifying statistics. It's terrifying, right? And falls are the leading cause of accidental death in the elderly, so 65 and older. Terrifying statistics. But there's good news to that too. That doesn't have to be how your older golden years are going to play out. You can work on your balance, can work on your mobility even after the age of 65. Okay, it's not an end game and you say, oh, I've never been an exerciser, it's just not going to work for me. That actually isn't true, and the research tells us that. And the reality is, simple steps are actually very effective. Lots of little simple steps can add up and make a really big impact for that. All right, so I just want to talk briefly about some of the contributors to decreased mobility and falls. There's 3 main categories: sarcopenia, poor postural control, and then vanity, which is a true story. Okay, so sarcopenia is the decline of skeletal muscle. So your biceps, triceps, quads, those muscles with age. And it's one of the most important causes to mobility decline in older adults. It is primarily due to age, but there's also a lot of multifactorial things that go into sarcopenia. But it's kind of, again, the statistics on this are a little bit scary because sarcopenia starts to kick in your 4th decade of life for most people. And then by the 8th decade of your life, you've lost about 50% of your muscle mass, right? Just by virtue of getting older. The good news is, though, that there are many things that play into sarcopenia, and many of these things can be controlled with lifestyle and with good medical care and good consultations from people who know how to address these issues. So, for instance, making sure your protein balance is right, making sure your insulin levels and your hormone levels are correct. Your primary care physician is an excellent resource on helping you manage those aspects of your health. Inflammatory issues or dietary issues can easily be managed with a registered dietitian helping take a good look at your diet. Those are things that you can control, that you can proactively do to prevent sarcopenia. And then, of course, there's activity. So a sedentary lifestyle and inactivity will make you much more prone to developing sarcopenia or muscle loss than if you're active, okay? And that's where somebody like physical therapists or personal trainers, or even just having a sport that you really enjoy or an activity you really enjoy can help. So this is what sarcopenia looks like on a cellular level. So this is a small piece of a muscle that's been taken out and put under a microscope. So on the top, you have healthy young muscle. The muscle that has the fibers have a lot of bulk to them. There's a lot of good, healthy cellular tissue there. On the lower slides, you have the sarcopenia. You can see that those muscle cells have lost their bulk, right? They've kind of degenerated a little bit. But the good news is that you can stop sarcopenia before it starts. And this landmark study actually came out in 2011, which I really wanted to highlight the power of exercise here. So the title is, chronic exercise preserves lean muscle mass. What this researcher did was he took a bunch of, I think about 10 or 15 individuals. Some were triathletes, some were sedentary, some were in their 40s, and some were in their 70s. And if you compare the top image to the bottom image, it's a 40-year-old triathlete with a 70-year-old triathlete. They don't look that different, right? The muscle bulk is very highly developed in both of those individuals, even though they're 3 decades apart in life. They have good bone in the middle, so that white surrounded by black dot in the middle is the bone, the femur. This is a cross-section of these individuals' legs. And that femur on both of them is really strong and dense. So should that 70-year-old have a fall, he's very unlikely to break a hip, right? This middle image is a 74-year-old sedentary man. Looks completely different, right? He has a lot more fatty tissue around the outside, and the muscular tissue is much more atrophied than on his counterpart, that 7-year-old triathlete. So the point of showing you this is just to show you that there's a lot of power behind exercise and maintaining your mobility so that you don't lose your muscle mass as quickly. So what does that mean in real life? So in order to prevent sarcopenia, the best thing you can do is weight lift. It's resistance training. And resistance training has to meet the demand a little bit above what your body wants to do. So if you're just taking like a 2-pound weight and you're lifting that 500 times and you're not tired, it's not doing anything for you, right? You have to find the right balance of adding just enough weight to challenge that muscle to grow, but not so much that you're straining it. And that's a fine line, it is. But a good telltale is to say that your muscles feel a burn after you exercise. If you're exercising and you don't feel a burn, you might not be doing enough. And again, there's other factors involved here. There might be other conditions to consider, but general rule of thumb, resistance training is very, very powerful. Okay. All right. Another aspect to falls and losing your mobility is posture. So think back to when the slide about an infant developing from 0 to 1, that baby essentially has perfect posture, right? They kind of have to, because otherwise they'll topple over. And as we get older, we develop so much muscle strength and motor control that we don't have to be perfectly positioned anymore to maintain our balance. So we get into very bad habits. We start to slouch at our computers for 8, 10, 12 more hours at a day, depending on what kind of work that you do. You might end up getting into bad habits with how you lift and move and push and pull things and end up hurting your back and creating problems there. And so we end up having this faulty pattern of postural stability. And so the only way to counter that is to know what good posture is and to know how to correct that posture as much as possible. So this is a great example here of someone in the middle has great posture with the line going straight through their ear, shoulder, hips, knees, and ankle. And then you have your poor postures on either side, which look a little different, but both of those create this sort of situation where the weight distribution in the feet isn't very good. And so if our little lady who's bent over here takes a wrong step, she's going to fall forward or backward because that weight distribution isn't very good, right? Whereas as soon as we cued her to stand up straight, this is a patient of the business owner, Matthew Reardon, and as soon as he cued her to stand up straighter, now all of a sudden she had much better balance simply because she wasn't in a position of risk being kind of bent forward. Right. Now, this is a little bit more complicated. Your whole posture and balance systems are a little bit more complicated than just saying stand up straight. There's a few things that go into that, particularly understanding the multiple systems that go into balance, right? Think about the fact that you have very small feet compared to your body and you're standing upright. How does that happen, right? We have several systems that perceive our internal and external stimulus to help us stay balanced and maintain our center of gravity. So that balance system is made up of your visual system, your vestibular system, and your somatosensory system. Your visual system is what tells you what you see, right? So you look around the room and you say, I know that I'm standing upright, or I know that I'm looking at the floor. And your brain is what interprets what you're seeing. So problems in either part of those areas can change your balance, right? Can change how you interpret the world and how your body responds to that. So if you wear glasses, I would encourage you to every year check in with your ophthalmologist to make sure that you are having the right prescription, that you're seeing the world at the best way that you can see it, because that your brain needs to interpret that information to help you balance. If you're finding that you have your vision's pretty good, but you're still having trouble with your vision, maybe you're seeing double or you're only seeing part of your visual field, that might indicate a more serious problem. So it's good to every year check in with your ophthalmologist to make sure that your eyesight is functioning properly. And your vestibular system is actually one of my favorite systems to work with because it's your balance system inside your ear. And it's fascinating from an anatomical perspective because you have these tiny cellular system behind your ear called your semicircular canals. And there's fluid within these canals. They go in 3 different directions to help orient you. When that fluid doesn't flow properly, these tiny little hair cells don't know which way is up and down, and they can totally make you feel dizzy and out of whack very, very easily. So if anybody's ever had any vertigo, you might have heard the term benign paroxysmal. I see some nods in the audience. Benign paroxysmal positional vertigo. So if you tend to be prone to getting really dizzy when you turn over in bed or change positions quickly, that might be something that you're suffering from, where this fluid isn't moving correctly inside your vestibular system. The really good news about that is it's actually very easy to treat. Physical therapists treat it all the time, and as do ear, nose, and throat specialists. So if you're finding that, that's something that you'll want to talk to about with your doctor or maybe even your physical therapist and say, hey, you know, I've been getting really a lot of vertigo when I turn over in bed, something that can be very easily treated. Earwax can also disrupt your vestibular system because of its proximity to those canals, as can medications. So again, having a pharmacist or a really good relationship with your primary care, make sure that your medications are being monitored properly so your vestibular system can always function at its best. And then finally, this is where I probably work the most in this system, is your somatosensory system. That is essentially your information superhighway from your brain to the entire rest of your body. That's your nervous system sensing up and down the path. That's what makes you feel touch, pressure, pain, temperature, position, movement, and vibration. There's literally millions of sensory input coming in and out of the body at all times. And those signals tell your body which way you're going and which way you need to react in order to stay upright. Okay. Now, pain is what I know I deal with as a physical therapist a lot, because when you experience a lot of pain, that system is disrupted and the reflexes don't necessarily work the same way. So what ends up happening, especially with pain, is that you will compensate for how you move when you are in pain. So here's an excellent example of that. This person is walking. You can see she's got a significant limp. Just background, she has some knee pain, right? But knee pain causes her whole body to change how she's moving. She's leaning to one side. She ended up coming in. It started with knee pain, now starting to have back pain and a little bit of hip pain. Now we add a cane. This is what I mean by vanity as a flaw. Nobody ever wants to use a cane. But once we added a cane, once we added that cane, she no longer has the limp. A lot of the pain went away. She's much less at risk for falls, and she's able to rehabilitate herself a lot better just by utilizing an assistive device to help her. Okay. So that's very important. That's why I said vanity is not good for, being too vain is not good for maintaining mobility. You need to sometimes have something help you along the way. There we go. So it's gonna, there we go. And then just as a side note, making sure you have the right cane fitted properly is also important, because if your cane is too long, you won't have the leverage to push down on it. If the cane is too short, you'll still lean to the side, so it won't help you really. You need your cane to kind of be right next to you with your elbow bent to about 30 degrees or so. So you have kind of maximum leverage. Additionally, if you do need to use a cane, it should be used on the opposite side of your problem. So if you have a right knee problem, you should be holding that cane in the left hand. Okay. And if people have more questions about that, I'm happy to answer those in a little bit. So how do you actually maintain your mobility, right? We've talked about some strategies so far, making sure you're up to date on your vision, making sure that you're using an assistive device, making sure you have your medications under control. Those are all steps you can take, but you can also take steps to keep your mobility from the perspective of keeping all your joints and muscles as healthy as possible, right? So that you maximize your somatosensory input and maintain how far you can move and the functional things you can do. So making sure your neck stays flexible, you need to be able to turn your head to back a car out of a parking space. So you got to have enough room to turn your head side to side. You need to be able to move your shoulders enough to bring things to you or push them away. You need your hips and pelvis to keep you stable enough so you stay upright in that vertical position. You need your hips to be flexible enough to clear obstacles like negotiating stairs. You need your knees to be strong enough to move you forward as well as to clear obstacles. And you need your foot and ankle to be stable enough to help you navigate uneven terrain or even do quick reactions if you do happen to stumble and lose your balance a little bit. So this is the practical part now. So let's say, you're having trouble walking, you can do a pretty quick functional assessment on yourself. First thing that you would need is enough big toe extension. I know I've been a PT for almost 16 years. No one ever thinks about how important their feet are, but your feet are your base. They are what holds you up. So, when you get home today, take out this slideshow and try to see how flexible your big toe is. Does it go all the way up? Does your ankle move up and down enough, right? Does it go up 10 degrees up and at least 20 degrees down? I'll show you what that looks like on the next slide. Your knees need to bend at least 90 degrees in order to sit in a chair. If they don't bend that much, you're going to have your leg kicking out and you might not be able to sit in certain places. You need your knee to straighten fully in order to walk effectively. You need your hip to bend to at least 30 degrees to clear objects. And you need your hip to extend behind you at least 15 degrees. So what does that look like? So you've got this great skeleton here. And you can see on the first skeleton where his leg is behind him, that's about 15 degrees from the center line. He needs 20 degrees at his ankle to push off the ground on that same leg. And then when you come forward, you need your toes to clear the surface so you don't catch your toes on a carpet or anything like that. So working on just moving your ankles up and down can be really, really powerful. All right. And there's just an example of how much motion you need to climb steps. It's quite a bit. So what can you do? You can easily exercise at home and just work on things, or you can go to a fitness center, or you can join many senior centers have exercise classes as well. But even at home, easy things you can do. We can practice this together now. One of my favorites is what's called a cervical retraction and rotation. So most of us are kind of here, bent forward. I know I do that when I'm sitting at my computer as well. But in order to turn your head effectively, you have to get your shoulders upright. Okay, so if you sit up really straight and tall and then bring your chin sort of down and back, right, that's good posture. From here, work on turning your head right and left. If you let yourself slouch and then work on turning your head, you're not really maximizing what you can get out of your spine, right? With your shoulders, you want to try to bring them back as far as you can, overhead as far as you can. The example I put in here is a TheraBand exercise. So if you take like a stretchy band, just pull that band all the way open. It helps with your posture as well, squeezing your shoulder blades down and back. And the same thing with your shoulders, kind of pulling bands apart, elbows in or elbows out can be really helpful. And then we have our lumbo-pelvic mobility, right? So in order to get out of a chair, you need to have pretty strong legs and a pretty strong core. And one of the best ways to do that is to practice getting in and out of a chair with no hands, right? So just getting to the edge of your seat, put your feet under you, push up, and then sit down really nice and slow with good control. That's essentially doing a squat, but really safely. And it's an excellent way to work on your balance, right? Because you don't want to fall back or go forward, and it'll help you keep your knee bend at least to that 90 degrees that you need. And when you stand up straight, really tighten your thighs to get your legs all the way straight. So very functional exercise that you can do. Work towards lower surfaces as possible, thinking about the fact that the average toilet is, I think, 16 inches or 18 inches. I think they're 18 inches now. They used to be 16 if you go into older buildings. So that's pretty low, right? You need to especially if you're a taller individual, you really need to try to maximize that to get up and down off of lower seats. And then my second favorite exercise for the hips and legs is a lunge. So the image here shows this person going down into a very deep lunge. That might not be possible for everyone, but that's okay. You can just start with some small lunges at first, maybe even holding on to something. And then over time, work on that depth as tolerated, or work on the amount of reach that you're getting with your legs. But when you do that, you stretch your ankles, you bend your knee, you extend your hip, you flex your other hip, and you bend your other knee. So you're kind of getting all of these lower extremity parts all at the same time with one particular exercise. And then if you're not able to get down into a lunge, you can still get into that position with a chair stretch to help you stretch those tissues without the load of having your whole body weight on there. So that picture is an excellent example of kind of scooting over on the edge of a seat and then kind of wiggle your leg behind you so you get a nice stretch through the front of your hip. I call that an anti-sitting stretch. I think it's one of the best. All right, and then for your knees and ankles, even just sitting, kicking your legs out straight and bending them back, a great way to work on knee mobility and knee strength if you add a little bit of weight to that, right? Maybe an ankle weight. And when you're walking, just think about hitting the ground with your heel so that your toes are up and your knee is straight. And as you come through, roll off that big toe. If you roll off that big toe, you automatically get a stretch on your big toe. So you kind of do these things functionally if you're doing them well, you're doing them on a regular basis. And then ankle, heel, toe raises. Again, watching to make sure that you are keeping your knees straight while you do these. And if you notice the person on the slide, when they lift their toes up, they don't stick their butt back, right? A lot of people like to kind of lean back when they do those. That kind of defeats the purpose because it doesn't make you actually lift your toes. It just makes you fall backwards. So try to make sure you actually lift your toes if you try these at home. And then my favorite, which is one of the best ways to make sure that you stay in shape, is to make sure that you can get off the floor safely. So this example is what we consider in the PT world, the optimal level of core strength, being able to get up and down off the ground without even using your hands. It's extremely difficult to do. Most teenagers I work with can't do this, so don't feel bad. It's very hard to do, but you might be able to try it this way. And this is an excellent way to also practice your mobility and your strength and make sure that you are minimizing your risk of falls. I couldn't find the data on it, but I know that being able to get off the floor is a predictor of longevity. And I couldn't find the data, so I didn't put it in the slide. But if you Google that, I'm sure you can come across it. There were studies done on this where individuals who can't get off the floor have a shorter life expectancy. So practice these skills. Let yourself, take advantage of where you are and try to practice them if you can, so that you maintain as long as you can. And then, of course, standing on one foot is also an excellent way to work on your balance and stability. And practicing eyes open, eyes closed would just add a little challenge to it. So, exercise is just one portion of what you can do. I mentioned there's a lot of other steps that you could take. And I think staying active in general, I think groups like the Old Guard, where you get out of your house and you come to something that gives you a sense of purpose and enjoyment, those are all wonderful things. Try to maintain a routine with your daily activity. So you're always doing something actively, whether it might be grocery shopping, a house of worship, a community organization, go to the gym, or someone earlier mentioned they were going to Summit for some exercise classes. I think that's just a wonderful way to do it. And make good daily choices every single day. Try not to sit for long periods of time. I will often recommend to my clients to set a timer for 30 minutes and then get up, right? When that timer goes off. I know if you're really engrossed in something, myself included, sometimes I'll spend hours just sitting at my computer working. It's really not good for your body to do that, right? We have this saying in PT where the next posture is the best posture. So the idea being that the more you move, the better off you are. Take regular walks, make several trips when you're going to the grocery store. A lot of us like to, try to be like, oh, I don't want to go into the house again. So you'll take like 10 grocery bags at the same time. It's not the safest way to do that. And it's also, you lose a little bit of practice that way. So it might be better for you to walk back and forth 4 or 5 times rather than try to take one trip. Use the stairs instead of an elevator if you can. And then, chair yoga, if that's a little bit much for you, ride a bike, go dancing, whatever makes you happy. Keep moving. All right. Remember, it's Newton's law, a body in motion stays in motion. Okay. All right. So, and then, if you have questions or whatnot, I work for Better with Physical Therapy. We are inside the Madison YMCA. We often do community things like this. And we just love helping our local community move better, live better, and stay well. So if you guys, and that was the other thing. Many people don't know that physical therapists are actually frontline providers. So in the state of New Jersey, you have direct access to physical therapists, which means that you do not need to get a prescription from your physician to see one. So if you do have issues with anything that we discussed, or you have concerns, call up your physical therapist if you have one, or call our office, and we'd be happy to help you and walk you through that process. All right. So thank you. Are there any questions?
Yeah, great talk. Thank you very much. Yeah, I always thought I was in reasonably good shape, but I'm fooling myself. My wife tells me I slouch all the time. Coming in, I'm at my desk. But anyway, I have a very specific question for you. And that is, in one of your slides, you talked about for shoulders doing a horizontal ABD. I don't know what ABD is.
Oh, sorry about that. That means abduction. That's our abbreviation. So that's any
Okay.
motion away from the body. So you're going out away.
Thanks.
Yeah.
Yeah, well done, very informative. I have an observation, and maybe this is the right audience to do it. I attend classes 4 days a week at the Summit Community Center. By the way, it costs $10 a year. So if any of you are a little tight with money, you can open up the wallet a little bit. At least let a fly out, whatever, a moth. My observation is that when I attend these classes, and I also do water aerobics at the Summit Community Pool, unfortunately only 10 or 12 weeks in the summer, but where the hell are the men? I mean, the class that I attend at the pool in the summer, there must be 50, 60 women and maybe 2 or 3 men, and I'm one of those. The class at the community center, the chair yoga, often I'm the only man and about 20, 25 women. I'm puzzled. So maybe the question is really for the audience. Why don't you attend exercise classes as simple as chair yoga? Why don't you do a simple aerobics class with even 2-pound weights or walking around? Where are you?
I think that's an excellent question. Yeah. I don't know that I have an answer, but that's a similar observation that we have in the PT world. It's difficult to get men involved in social exercise. But pickleball seems to be changing that. So if nothing else, pickleball seems a good way. I think before that it was maybe racquetball. I'm not a man, so I don't know that I can speak to the psychology of that, but it is a challenge to get men involved in sort of more social exercise, unless it's something that you particularly like. Maybe it's more about sport. I don't know. Perhaps somebody in the audience can shed some light on that. I see a hand up over there.
No, we're here.
Oh, right there.
I'd like to ask you about neuropathy.
Okay.
You hear a lot about it, and of course, it's very disabling if it's in your feet. There are all sorts of, oh boy, there are all sorts of treatments. I'm getting feedback.
From that.
There are all sorts of treatments for neuropathy that are advertised. Can you give us any advice about those treatments? Do they make any sense? There's lasers and all sorts of things. Can you just brief us a little bit about that?
I can do my best. Yeah. I think a lot depends what's causing the neuropathy. I think that's very important to understand. There are different types of neuropathy, and there's different reasons that it might develop. Like for instance, people with diabetes tend to be prone to neuropathy. That has to do with how your nervous system processes sugars. And over time that degenerates, or the lining around the cells degenerate. And that's, from my understanding, a permanent situation. But there's other neuropathies that develop because you have spinal problems, or you have the kind of unknown origin of why these neuropathies start. So depending on the cause, I think would help direct treatment a little bit. So for instance, if you have a spinal neuropathy, you might need injections in your back, or you might need some sort of therapy to open that space. If you have diabetes, you need to work with your doctor to manage your diabetes. The symptoms of neuropathy do often get referred for physical therapy. And I know there's a lot of products on the market that seem to help. Sometimes cold lasers or lasers can help, but that's not very often. It's not the rule. I recently had someone come in with some homeopathic remedies that they said really helped. A lot of this is just anecdotal. I think research-wise, there aren't any straightforward answers on that, unfortunately. But I would encourage you to explore your options with your physician or whichever primary care provider is helping you with that, and try some things and see what kind of works for you and what doesn't. Does that help answer that question a little bit? It's a tough question because it really depends what's driving it.
Yeah. Oh, yeah. Up here? Yeah. Okay. Thank you. Great presentation. Very much enjoyed it. Mike Martin. Yeah. 2 questions. Okay. Well, that was the first. No. 2 questions. One, you talk about chronic exercise for the average person in this room who suffers from aches and pains and all that stuff.
Yeah.
What is your definition of that? And secondly, the intensity of that activity or exercise, what recommendations, should sit and stand and this type of thing. So frequency and intensity. Thank you.
Sure. So a lot is going to depend on your individual needs, but I would say a general rule of thumb is to have 2 to 3 days a week of strength training exercise and 2 to 3 days a week of cardiovascular based exercise, walking, cycling, swimming, things like that. For people who have a lot of aches and pains like arthritis, which is very common, being in the water is a wonderful thing. It's really great. So that might be a good example for that. Strength training is a little bit more challenging when you have challenges with arthritis or other aches and pains. And I think that's where you might need someone with a bit more skill level to evaluate your particular situation. But we know from the evidence that people with arthritis in particular do very well with exercise. It just has to be the right load of exercise. You can't overdo it and you can't underdo it. And that's a very difficult balance to find, just depending on the situation. Does that help answer that question? Great. I think there was another question. Maybe. Sure.
I have a question. Suppose that you're 97 years old and you've been sitting around too long and you want to get back into shape. Is it possible to rebuild your muscles?
So I never say never. And the reason I say this is I recently had a 95-year-old turned 96 while I was working with her, and she came in with a broken ankle, and I got her doing lunges and squats in about 8 weeks. So there's room for improvement for everyone most of the time. I would say that, of course, it always depends on the individual circumstances, but if you've been active your whole life and you've maintained your body fairly well, you might need to modify things, but there's no reason that you couldn't try to make some progress with your mobility, even at 97 or 98 or 100.
Well, thank you.
Excellent, very comprehensive presentation, which I agree wholeheartedly with. The one thing that I'd like to see a little bit more emphasis was aerobic activity, in that as a former miler, 2-miler in college and ski racer and other athletes, other activities, I've always believed heavily in aerobic activity. And it can be as little as walking at our age, which is my primary aerobic activity, or stationary bike riding, or treadmill, that sort of thing indoors, which is even safer because you can control it more. But I think it encourages good deep breathing, and the aerobics are so good for the lungs and the cardiovascular system that I think is something that we all need to try to maintain. But anyway, thank you very much for a good talk.
Thank you.
Hi, I'm John Tomaszewski. Enjoyed your talk. My question is, I was talking to my brother about a back operation, and I had a little bit of pain in my back, and he told me to get this CBD oil, salve.
Mhm.
And I'm not really into those kind of remedies, but how can you say no to your brother? So I went out and got it. And to my surprise, after 2 or 3 days, my back felt better. Now, I don't know whether that was psychological or what, but what are your thoughts about marijuana and salves?
Oh, that's a great question. I need to actually take a course on that because I'm not well versed in it, but I will say a lot of my clients recently have come in with both medical marijuana prescriptions for like topicals as well as CBD. The one thing I would say is that while medical marijuana, so THCs, are highly regulated already, and they're monitored by physicians and the significant organizations to make sure that that's all safe and clean and all of that, CBD is not. And so that's why you see CBD everywhere. It's actually not that difficult to manufacture, and we don't have evidence on how much or how little you need to use. So I think there's a lot of room for improvement in that, but I've definitely had patients love it and anecdotally really say that it's helpful for those kind of chronic ache and pain issues. So if you get a good one and it works for you, I think that's fantastic.
Yes, my name is Mano Millis, and I have a question. I recently tore my rotator cuff, and pretty painful. Any thoughts on that?
Oh gosh. Again, I don't know your specific circumstances, but I am sorry to hear that you tore your rotator cuff. That's a very, very painful injury. Have you seen a physician already? I guess is my first question.
I'm going to be seeing somebody tomorrow. So I figured since I had another expert on the line, I might as well get as much information as possible. But you're right, it is very painful.
Yeah, they're very painful. Well, definitely first thing is to see an orthopedist and determine how big that tear is and what kind of treatment is indicated. Small to medium tears usually do very well with conservative treatment like physical therapy and medication. Larger tears sometimes need surgery depending on the circumstance. So that you would need a diagnostic test to find out where you are. Yeah.
Good. Thank you very much. I
Pleasure.
enjoyed your presentation very much.
Thank you. I think there's a couple more questions. Yeah.
Hope I'm not violating the rules of taking 2 bites of the apple, but Vito Gallo. The fall issue, I think I have heard a lot of murmuring when you mentioned falls, and the statistics are very scary.
They are, yeah.
I'm probably foolishly walking around with bifocals on, and I find that I trip a lot.
Yeah.
But yet I need them when I drive because I can't see
Right.
the odometer and the
Right.
speedometer.
Right.
And also pedestrian. I find it's very dangerous walking around downtown Summit, for example, because driving behavior is severely deteriorated since the pandemic.
Yes.
They don't stop at stop signs.
Yep.
They do the running, the rolling stop,
Right.
and they speed.
Right.
And I feel like we're sitting ducks as senior citizens. We don't move as fast as the teenagers.
I agree.
I suspect teenagers don't get hit by cars as much as
Well,
as
you'd be
older
surprised
folks.
because they are on their cell phones.
Okay,
they don't
well,
look up.
that's an older bad behavior. Oh, yeah, driving and walking,
Yeah.
but just pedestrian activity, we're all encouraged. And you can see there's a lot more effort here in New Providence and the other towns to warn drivers about pedestrians, but
Right.
walking is, I think we need to find safe walking paths and parks
Yes.
and things of that sort.
Yes.
Just a comment.
I think it's great if you do want to walk, especially in the wintertime, go to the mall. Mall walking is a very useful thing to do. It's safe. They open the mall I think about an hour earlier for mall walkers, and you can walk to your heart's content up and down. There's stairs there, so you can practice doing stairs, ramps. The mall is a great place to walk if you can't get outside. If you can get outside though, at least around here, yes, the walkways are potentially dangerous, but there's some really good parks in the area that are either like carriage roads, which are fairly level if that's what you need, or paved, which are also quite safe. The only thing you have to watch out for is cyclists sometimes in those areas. Yeah. Some people think they're riding in the Tour de France on those roads. So.
A wonderful talk. I've been doing 25 push-ups a day all my life since age 20. All of a sudden, I've realized I'm getting older. Is it safe for me to continue doing this?
Absolutely. Absolutely. I say do them as long as you can do them. There might come a point in time where that changes, but for right now, if you can do them, do them. And even once you start to struggle, you can modify them and do them on your knees, or you could do them on a table or an incline. Continue doing them as long as you can. As long as it feels good, continue.
Yes, I had a question. You talked about using weights, and I use exercise bands. What's the difference between using weights and exercise bands?
There actually isn't that much of a difference between the two. I would say it's a little easier to know how much you're lifting with a weight because the band changes resistance as it stretches. But both are excellent depending on the type of exercise. So if you're someone who doesn't have the space for a big weight rack or doesn't want to go to the gym and you just want to do things at home, bands are excellent, especially the ones with the tubes with handles. And I probably should have brought some. They make a little device that you can close into a door. It's like what's that material? Like a neoprene device. You close it in the door, you can put your loop through so it can go anywhere on a door. You don't need any fancy equipment to exercise. And bands are fantastic if you get the right resistance on them.
Thank you.
Hi, Bobby.
Hi, Michelle. Michelle is now my physical therapist, and I'm very much impressed by her. And she gave a lot of good tips. And what my question is, I didn't know that some of the things that she does may not be very apparent, but the theoretical lecture that I never heard from her sort of made me realize that how much more the physical therapists do behind the scene and the education they go through. And I'm quite impressed. But Michelle, the problem that I have is I try to do too many things too much. In fact, one of the things that I have inertia. If I do something, I keep doing it. And I don't know, is there a remedy for that?
What, is there, I don't know that I understood the question. I'm sorry.
Uh,
You're doing too many things, Bobby?
I'm doing same things, but whenever I tend to do something, I tend to keep doing it because I don't realize that I have to get up after half an hour. Because
Yeah. So I think timers can be helpful in that regard to help remind you to change what you're doing, change your positions. You know, every phone has a timer. If that doesn't work for you, get a kitchen timer, set it for 30 minutes, change your activities around, change what you're doing frequently.
Thank you.
My cat's here. I wanted to replay the personal experience I had several years ago with neuropathy in my feet. And all of a sudden I developed a good deal of pain in both my feet, and I consulted a podiatrist and he prescribed injections of alcohol. And this persisted over a course of 2 or 3 weeks. The injections were not terribly comfortable.
Mhm.
What was even less comfortable was A, the fact that it didn't work, and B, the bill that I got for it. And after which I said to him, "What were you injecting me with, single malt scotch?" Anyway, in discussing this with someone else, they said, maybe the problem's with your shoes. And recommended that I go to Walkwell in Summit, which is a shoe store probably most of you are familiar with. And
Yeah.
they have orthopedic type shoes, and some of which are pretty decent looking. I see about the only shoe store left in Summit for that matter. But I went there and I replaced all my shoes with the ones I had, never had a problem with since.
Oh, wow. That's, I've actually hadn't heard someone have so much success. So that's excellent. But yeah, again, I said the cause of, determining the cause of neuropathy is usually the best way to determine how to fix the neuropathy, or at least treat it as best as possible. So I'm glad you found a solution. There's
One more.
Hello. I've been a big walker all my life. When I was a kid, to walk 5 or 10 miles was never a problem. But now I have this artery disease. I can walk about a mile and then the pain in my calves is very severe.
Mhm.
I have to sit down. Do you have any solutions for that?
Cycling. A stationary bike is an excellent alternative if you can, because then you don't have as much pressure on your legs when you're moving. So it's a little bit easier on your body and you can still get some cardiovascular benefit from that.
Okay, thank you very much.
Yeah. Well, thank you guys. This was very fun. Thank you.
Great talk,
Thank
great
you.
presentation. We have a number of ways of thanking our presenters. The first is a certificate of appreciation. And what I'd like to point out is in the certificate, we have the orchid, which is from Summit, because Summit, way back in 1930, when the organization was formed, was the capital of the growing orchid growing world.
I did not know that.
And they were prolific. And last week's talk, we heard about the demolition of the last greenhouse
Oh,
in the early 70s.
oh. Well, thank you very much, George. Appreciate that.
And another way is an orchid for you that we present the women presenters with. And the final way is the Olgar salute.
Thank you.